Welcome. My name is Dr. Washira Murage, a consultant obstetrician and gynecologist at the Savannah Hospital. I would want to bring to our attention a very common problem that has occurred of late. It's now quite common in our mothers who are pregnant. The hypertensive disorders in pregnancy. And the most common is called preeclampsia. The hypertensive disorders in pregnancy are divided into the following groups. We have chronic hypertension, that is someone who has been chronically hypertensive and now they are pregnant. We have preeclampsia, which normally starts from 20 weeks going onwards. That is pregnancy related. We have chronic hypertension superimposed with preeclampsia. That is a person that is chronically hypertensive, non-hypertensive, they have been taking drugs, but now on top of that, they get now that special pregnancy induced by hypertension. And then we have a transient pregnancy-induced hypertension. That just comes for a short time and then disappears. The most important that I want to discuss today is the preeclampsia. Because if you walk into our labor wards today, you'll find almost about 1/3 of our patients are suffering from this condition, which is normally very detrimental to both the mother and the baby, and of course to the family, especially the immediate family, because of the increased neonatal and maternal morbidity and mortality. By that I mean the increase in disease process during that particular time emanating from the preeclampsia, and in some cases, death of the mother and the babies. Preeclampsia normally starts classically from 20 weeks. And how does it start? It may start with headaches, very severe headaches, and the mothers will also get facial puffiness and generous body swelling. They may get an upper epigastric pain, that is a pain at the tummy, on top of the tummy where acidity occurs, and they may also have blurring of vision. Those signs and symptoms that come to the mother, coupled with some proteins in the urine and a blood pressure of 140 over 90 and above, make a diagnosis of preeclampsia. Preeclampsia is divided into two. We have mild or preeclampsia with mild features, and you have preeclampsia with severe features. The one with mild features is basically an elevated blood pressure, a proteinuria, proteins in urine, maybe 1 plus. They may have maybe some headaches, maybe some swelling here and there, but it's generally managed as an outpatient. And such mothers, we can be able to manage them until about 38 weeks when we deliver them. When it comes to the ones with severe features, you are talking of a mother that is sickly. You are talking of very bad headaches. You are talking of blurring of vision. You are talking of very severe abdominal pains. They could also be in labor. They could also be bleeding. And the baby sometimes could also be affected. You're talking about the blood pressure being very, very high, 160 over 110 and above, and you're talking of the proteins in the urine 3 plus or more. That is normally a very grave situation. And if it comes early, before 37 weeks, and you are considering to deliver, we are normally at loss. Because you have said, according to definition, preeclampsia comes after 20 weeks. So you may get severe features when it's very early, when you have severe prematurity. You may also get it maybe around 34 weeks. But for the sake of management, we are very worried when it comes below 34 weeks. Above 34 weeks, we normally are able and are more comfortable because we know the baby can always survive. We have now the extreme of the severe features, which is now eclampsia. This is PET with severe features coupled by fits. The patient comes with epileptic form of fitting, and that one normally is immediate delivery because it can damage the brain, Even the baby sometimes comes over and it's dead. The mothers can inhale. They go to ICU. So when they come with that severe form, the eclampsia, then it means that you want to deliver because the consequences can be dire. So mild eclampsia, we are now discussing management. How do we manage mild eclampsia? Mild preeclampsia is generally an outpatient management. You control the blood pressure, take care of the kidney, take care of the liver, take care of the mother's well-being in other aspects, and to go with that, make sure the baby is safe. When it comes to severe features, then you're trying to control the blood pressure, you're trying to take care of the kidney, you're trying to take care of the liver, take care of the brain, take care of the eyes, because these are the main organs that are normally affected, and that's why you're talking of severe features. In such a baby, it's also at danger. We are saying that in eclampsia, the organ that is normally affected is the placenta. That is where the basic main problem is. The placenta is defective, and therefore even the nourishment that goes to the baby is affected. When the placenta is affected by preeclampsia, it hardens kind of a thing. So it's not able to pass freely the flow from the mother to the baby, and therefore that affects the well-being of the baby. And the blood there is like a backflow, and that is now what damages the organs in the mother. So when you're dealing with severe preeclampsia, you're saying that this baby could be in danger. So when you're managing a patient with a preeclampsia with the severe features, you're saying that you are balancing. It's a balancing act. How is the mother? Are we able to go on? How is the baby? Is the baby in good order, in good shape? Or what do we do? So it's normally a balancing act. And when you have the mother being very endangered, for example, you have maybe they're suffering from chronic failure, or maybe they're almost having an imminent eclampsia and fitting, then what happens that you have to deliver that particular mother, because the cure for preeclampsia is delivery. It's for you as a physician plus your patient to decide at what point is it best for the interest of the mother and for the interest of the baby to deliver. As I said, when it's below 34 weeks, you try by some time, you try and give even medication to mature the lungs of the baby, and most of the time you do a cesarean section. Above 34 weeks, then you're comfortable, you do deliver the patient. How do you deal with eclampsia? Eclampsia is an ICU. So normally what you normally do, you stabilize that patient, make sure you monitor the urine output, make sure you control the fits, make sure you control the kidneys, assess the baby very quickly, and then do a delivery. We prefer normal delivery in such situations, but most of the time we run for cesarean section because we want to deliver to avoid further fitting to the mother. And then most of the time we deal with those mothers in either ICU or an acute room where the mothers are monitored throughout. Preeclampsia. How can we prevent preeclampsia? Let me say difficult. How to prevent preeclampsia? You can do so little, but one of the things, of course, we say for the mothers, let them reduce weight as they get to pregnancy. If the mothers have things like diabetes, hypertension, let them be well controlled. If they have thyroid diseases, let them be well controlled. Let them go for antenatal clinic care early, especially if they have ever had preeclampsia before or they have those diseases. Let them come to the clinic early. There are some drugs that can assist, and those drugs are like junior aspirin, vitamin E, calcium, and other multivitamins. They kind of help to keep the placenta integrity very good, because remember we said that the preeclampsia pathology or problem is at the placenta. What happens is the blood vessels get narrowed. So those drugs kind of helps to keep the blood vessels patent for the smooth flow of blood. So in terms of prevention, that's the best you can do. But when it sets in, critical care, good follow-up, and be able to know that the delivery you have to go on where there is an obstetrician and gynecologist, where there is a neonatologist, where there are newborn services available, where theater is available. It's very, very important, and where critical care like ICU is also available. So preeclampsia, let us remember preeclampsia, especially when you see our mothers are coming up 22 weeks, they are swollen all over, they are having some headaches. Let us remember to go to the clinics and have the checkups. Thank you.